We're also tracking some breaking news in Ontario because that province is reporting 900 patients in intensive care. That too is a record high. That 900 patient threshold is one experts have been keeping an eye on for weeks. Some say hospitals could now have to trigger triage protocols. We have heard from the Ontario Ministry of Health, and they say the triage model has not been activated at this time. But across the province, there are more than 2,100 people in hospital. Ontario also identifying today 3,369 new COVID-19 cases and sadly 29 deaths. Well, with that, we want to bring into the program right now Anthony Dale, the President and CEO of the Ontario Hospital Association. Anthony, thank you for being with us today.
Happy to do so, Michael.
Listen, you have long been warning about the rising ICU numbers in Ontario, and as we said, a new threshold is being met today. What do you make of this ICU number? 900 people in ICUs in the province. What should people in Ontario be making of this number?
Well, if you'd asked me this question months ago, I never in my dreams would have thought that we could have reached this very high level of patients so critically ill that from COVID-19 that they need life-saving support. And that's, of course, on top of the thousands of other patients who are also in hospital with COVID-19, but just outside the ICUs, getting other higher order levels of care. So the situation is unprecedented, using a term that is perhaps overused these days, but I never thought we'd see anything like this. I do think if there is a glimmer of hope or a green shoot, let's say, for spring, it's from the modeling of late last week from Dr. Staney Brown and the science table that suggests that in terms of community spread, the province may be cresting is the term he used, which suggests that we're reaching the top of the arc. Of course, hospitalization and admission to ICU is a lagging indicator. So we still will have to wait several weeks further to see the impact of community spread on our hospitals and intensive care units. So it's also important to know that what goes up must come down. And if we are cresting and if we are starting our descent out of this third wave, the modeling suggests it's going to be very, very slow and gradual because of the nature of the measures that are in place in Ontario. So we have an enormous amount of work ahead of us to keep people alive and to give people with COVID and without COVID who need access to life-saving care, the care that they need.
Okay, listen, I'm going to pick up on the modeling a little bit later, Anthony, but I do want to get back to this 900 number because as we have heard, this could be the trigger point for triage care in Ontario. We have to point out the Ontario Ministry of Health, they did provide us a statement just in the last hour. They say the triage model has not been activated at this time. But now that we are staring at this 900 number in the face, how much longer before a triage scenario is actually triggered in the province?
Well, I have to answer that question in a certain way, Michael, because I know it's top of mind, top of interest for everyone, but it would be a failure of all of us in healthcare if, despite this third wave, a hospital somewhere in Ontario has to use the triage tool. We continue to use an incident management system led by some fantastic physician leaders. We are transporting thousands of patients now from hotspots in the GTA to other parts of Ontario in a desperate race to keep them alive and make sure they have equitable access to intensive care services. So the triage tool is not in place. We're working as hard as humanly possible, our clinicians and the staff in hospitals, to make sure that it never comes into effect. But I can't say with complete confidence that it will never happen. I'm just saying we are fighting every day to prevent it from occurring.
Now, you talk about the nature of the measures in place right now. That seems to be having an impact, as you talked about, with where we are in the numbers and this cresting, if you will, of the curve. But do you need more from the province? As you say, what we see in hospitals and ICUs is a lagging indicator. Do you need more from the province right now in terms of tougher measures to make sure this cresting does go down and not shoot up again?
The Ontario Hospital Association completely supports the recommendations of the science table made last week, calling for comprehensive, aggressive attack really on COVID-19, this virus, which is actually attacking our communities. We're making some gentle progress, and we know from the modeling that it will take months if everything remains the same for this third wave to rescind. If we're more aggressive, we can get out of it faster. And I just looked at the front page of the Times of London earlier this morning, and there's a great big bright bold photograph of a nightclub that's now open in Liverpool. There's very positive headlines about within just weeks they'll be able to return to a greater sense of normalcy, including person-to-person contact that hasn't been possible for over a year. And that's because they fought this virus with everything they've got. And I just wish that with one final push, the leaders of this country and this province would realize that we have to be as aggressive as we can, follow the advice of people like Dr. David Naylor, who wrote about this in the Globe and Mail earlier this week, and we could actually have a relatively normal summer by July 1st, but it takes sacrifice and tough decisions to get us over the finish line. Otherwise, it's a multi-month gentle kind of slope out of this if, again, everything else remains the same. And of course, our hospital system right now is massively cannibalized. Personnel by the thousands, resources redeployed to intensive care and other very serious acute care services. The surgical backlog is 250,000 cases and climbing every single day this pandemic stays with us. And the consequences to human health from both COVID-19 and all the surgeries that are delayed or canceled because of this third wave and the pandemic in general, it will be with us for years to come.
Anthony, I want to thank you for joining us today. I appreciate your reaction to this new number of 900 people in Ontario ICUs.